Hello, I'm May King from the Cancer Institute Outreach Program, and I'm joined today with Beth LaFontaine, coordinator from the Bariatric Program from the University of Tennessee Medical Center. We're excited that you all have joined us today to learn some ways that you can actually lower your risk for cancer. First up is limit or avoid alcohol. This covers all types of alcoholic drinks, whether beers, wines, liquor, or any other drinks. Alcohol has been linked to several types of cancer. The more you drink, the higher your cancer risk. For women, you should limit to only 1 alcoholic drink per day, and for men, 2 or less alcoholic drinks. Next up is avoid tobacco, or if you smoke, stop smoking. Tobacco is made up of thousands of chemicals, including at least 70 known to cause cancer. Using tobacco leads to disease and harms nearly every organ of your body. If you currently use tobacco, there are free programs to help you quit, such as UT Medical Center's Smoking Cessation Program. If you're ready to quit, you can call 865-305-6970 or toll free 1-877-882-2737. Protect your skin. Skin cancer is the most common cancer in the U.S. Exposure to ultraviolet UV rays from the sun and tanning bed is the most important environmental factor involved with developing skin cancer. Avoid tanning beds. Seek shade, especially midday hours. Apply SPF 30 or higher sunscreen often. Wear sun-protecting clothing with hat and sunglasses. Next up, let's talk about staying active and exercise. Exercise is an important part of cancer prevention and living a healthy life. Benefits include obtain or maintain a healthy weight, lower stress, strengthens your immune system. And the goals for each week, you can either do 2.5 hours of moderate or 1 hour and 15 minutes of vigorous intensity exercise. Up next is Beth to share tips and tricks to help us all keep a healthy BMI.
Thanks, May. Reaching and maintaining a healthy weight is important for overall health and help to reduce your risk for many diseases and conditions, including cancer. Body mass index, or BMI, and waist size are great ways to tell if you are at a healthy weight. So what are some tips for you to maintain a healthy weight? I've got some lifestyle tips and some food swaps for you. So first of all, I know we're all kind of stuck inside, but cook instead of taking carry-out home. Go grocery shopping when you're full and not hungry. I'm guilty of that. Choose slowly. Studies show people who eat quickly gain more weight. Choose toast instead of a bagel. A single bagel can have the caloric intake of 5 pieces of toast. So enjoy a couple slices of whole wheat bread instead. Drink sparkling water instead of soda. Research has shown that soda is associated with an increased risk of obesity. Use oil and balsamic vinegar instead of processed dressings you buy at the store to dress your salads. Less is more. Use mustard instead of mayo. Mayo has a lot of fat. Mustard is naturally fat-free. Eat raw spinach instead of iceberg lettuce. Spinach is packed with vitamins, vitamin K, calcium, and iron. Eat frozen grapes instead of popsicles. It's like having bite-sized frozen nuggets, personal popsicles without the added sugar. And lastly, nap instead of sipping on an energy drink. Energy drinks can pack as much sugar as 6 donuts. Napping has no calories. So those are just some simple tips and tricks to help you reach and maintain a healthy BMI.